Hi, this is Tatcha from Weight Loss Lab, brought to you by NobleWiki.com. In this video, I want to talk about P.C.O.S belly fat. Before I continue, please take a second to click that subscribe button and turn on the notification bell so that you will not miss any of our awesome videos. And after you've finished watching the video, don't forget to check out the link in the description for further information and a special free resource guide we've created just for you. I bet you will not find these types of free resources anywhere else. Let's get started. PCOS belly fat. It is well known that polycystic ovarian syndrome, PCOS, may be quite difficult. It not only has a wide range of symptoms, but it can also be challenging to treat. The weight increase associated with PCOS is among its most annoying symptoms. Even though trying to lose weight is difficult, having PCOS can make it seem impossible. Women with PCOS frequently struggle with belly fat, which may be extremely difficult to lose. We'll look at a few of the reasons why PCOS belly fat develops in this video, along with some advice on how to get rid of it. Why does polycystic ovary syndrome cause weight gain? When PCOS is present, the body has a harder time using the hormone insulin, which generally aids in converting the carbohydrates and starches in meals into energy. This disease, known as insulin resistance, can result in an accumulation of glucose and insulin in the circulation. Male hormones known as androgens are produced in greater quantities when insulin levels are high. The signs of high androgen levels include body hair development, acne, irregular periods, and weight gain. Male hormones produce weight gain, which usually occurs in the belly. In this area, men often have more influence. Women with PCOS, therefore, have more of an apple form than a pear shape. The most hazardous type of fat is abdominal fat. This is due to the fact that it raises the risk of heart disease and other illnesses. What are the risks associated with PCOS-related weight gain? Weight gain can have detrimental effects on your health, regardless of its cause. PCOS women are more likely to develop weight gain and insulin resistance problems, including 1. Type 2 diabetes. 2. High cholesterol. 3. High blood pressure. 4. Sleep apnea. 5. Infertility. 6. Endometrial cancer. Heart disease can be caused by many of these conditions. How PCOS affects your body? It is normal to produce some testosterone, but too much can lead to ovulation failure and menstrual cycle disruption. The body produces much more insulin than normal to maintain blood sugar levels when it has insulin resistance. In addition to increasing testosterone production, excess insulin can contribute to 1. Reduced fertility. 2. Irregular or absent periods. 3. Excess hair on your body and face, hirsutism. 4. Less hair on your head, alopecia. 5. Changes in your skin, such as acne or darkened skin patches. What causes PCOS belly fat? A hormonal condition known as a polycystic ovarian syndrome, PCOS, can affect women who are fertile. It is one of the main reasons for infertility. When the hormone androgen is produced in excess by the ovaries, PCOS develops. Menstrual irregularities, ovarian cysts, and other symptoms may result from this. Insulin resistance brought on by PCOS has been linked to type 2 diabetes and weight gain. Although there isn't a single known cause of PCOS, it is likely a result of a mix of genetic and environmental factors. PCOS is a complicated disorder that many experts are still trying to comprehend. We do, however, know that PCOS may run in families and that way of living can influence how it develops. Millions of women throughout the world suffer from PCOS, which is a prevalent disorder. It is a major contributor to infertility and has been linked to heart disease and type 2 diabetes, among other health issues. What you can do about it. Menstrual cycles that are irregular or non-existent are the most typical indication of PCOS. Obesity, acne, and excessive body and facial hair are examples of other symptoms. Blood tests and pelvic exams can also be used to identify PCOS. There is no known therapy for PCOS. However, there are ways to manage the symptoms. Consult your doctor if you believe you could have PCOS. They can assist you in maintaining your health and managing your symptoms. Diet for PCOS belly fat. Dietary changes have a major impact on PCOS in two areas: weight control and insulin sensitivity and resistance. However, since insulin has a big part to play in PCOS, one of the greatest things patients can do to treat the illness is to control their insulin levels using a PCOS diet. People with PCOS may benefit from the following diets. 1. Foods with a low glycemic index, GI, digest more slowly, which means they do not raise insulin levels as much or as quickly as other foods, such as carbohydrates, whole grains, legumes, nuts, seeds, fruits, starchy vegetables, and other unprocessed, low-carbohydrate foods are common components of a low GI diet. 2. Foods that reduce inflammation-related symptoms, such as fatigue, include berries, fatty fish, leafy greens, and extra virgin olive oil. 3. Dietary approaches to stop hypertension diet. Doctors often recommend this diet in order to reduce the risk of heart disease. Additionally, it may be helpful in managing PCOS symptoms. There are plenty of fish, poultry, fruits, vegetables, whole grains, and low-fat dairy products in the diet. Sugar and saturated fat are discouraged in the diet. An 8-week study conducted in 2015 found obese women following a specially designed diet reduced insulin resistance and belly fat compared to those who didn't. A healthful PCOS diet can also include the following foods. 1. Natural, unprocessed foods. 2. High-fiber foods. 3. Fatty fish, including salmon, tuna, sardines, and mackerel. 4. Kale, spinach, and other dark, leafy greens. 5. Dark red fruits, such as red grapes, blueberries, blackberries, and cherries. 6. Broccoli and cauliflower. 7. Dried beans, lentils, and other legumes. 8. Healthful fats, such as olive oil, as well as avocados and coconuts. 9. Nuts, including pine nuts, walnuts, almonds, and pistachios. 10. Dark chocolate in moderation. 11. Spices, such as turmeric and cinnamon. Foods to avoid. It is generally recommended that people with PCOS avoid foods that are already widely considered to be unhealthy. Among them are 1. White bread and mass-produced pastries are refined carbohydrates. 2. Fast food, such as fried foods. 3. Beverages containing sugar, such as sodas and energy drinks. 4. Various processed meat products, such as hot dogs, sausages, and luncheon meats. 5. Lard, shortening, and margarine is solid fats. 6. Red meat in excess, including steak, hamburgers, and pork. Exercise for PCOS belly fat. Cardio. Walking quickly, running, cycling or swimming are all excellent exercises that can benefit PCOS. By increasing your body's sensitivity to insulin, this kind of exercise lowers your chance of developing type 2 diabetes and cardiovascular disease. Strength training. Beneficial for enhancing body composition, raising metabolic rate, and lowering insulin resistance, more muscle and less fat tissue. Squats, push-ups, and tricep dips are bodyweight activities that enhance insulin function while simultaneously increasing muscle mass, which increases metabolism. HIGH, intensity interval training. Beneficial for improving cardiovascular health and reducing waist circumference. During intervals, you alternate between brief bursts of intense effort and slower recuperation. It's a quick approach to improving your cardiovascular fitness and has additional PCOS advantages. Core strength. Beneficial for preventing injuries, improving overall health, and preparing the body for pregnancy. Include core exercise in your regimen because being overweight can lead to lower back discomfort and bad posture. Knowing how to activate these muscles can help you avoid exercising-related injuries. They support the spine. How to reduce P.C.O.S belly fat. Follow these easy and effective tips to reduce P.C.O.S belly fat. Practice mindful eating. Exercise regularly. Women with P.C.O.S are at high risk for heart disease and diabetes, so maintaining an exercise routine will help stabilize blood sugar. Manage stress. One of the main factors for weight gain is stress. Cortisol levels increase during stress, a hormone produced by the adrenal gland. Weight gain and insulin resistance are brought on by high cortisol levels. To reduce cortisol levels, put your attention on stress reduction techniques like yoga, meditation, and listening to calming music. It will assist you in losing abdominal fat and cultivating a good outlook to help you make better choices. Follow sleep hygiene. According to studies, getting too little sleep causes inflammation to rise, which aggravates P.C.O.S and encourages weight gain. Additionally, it raises your risk of cardiovascular disease and type 2 diabetes. Following these simple sleep hygiene tips can prevent you from gaining weight from belly fat. This is where we will call it a wrap for this video. Thank you for watching. Please don't forget to subscribe to us on YouTube, like us on Facebook, follow us on Twitter, Pinterest, Instagram, and TikTok. We will also appreciate and respond if you leave us a comment below to tell us what you think. If you found this video helpful, please do well to click the share button so that others can benefit as well. Keep your eyes on our channel Weight Loss Lab for daily exciting, informative and educative videos. Until next time, have a nice day.